What should I expect before a brain scan for stroke diagnosis? When a stroke is suspected, getting a brain scan is a crucial step to find out what's happening inside your brain. Before the scan begins, the medical team will usually review your medical history and ask about your symptoms. They want to understand when your symptoms started, how severe they are, and if you have any allergies or medical conditions. This helps them plan the best approach for your scan. Next, you will undergo a physical and neurological exam. The doctors will check your muscle strength, coordination, speech, and reflexes. This quick assessment helps them determine the urgency and type of stroke you might have. Once they decide a brain scan is needed, they will explain what to expect during the procedure. The most common initial scan used is a computed tomography scan, or CORT scan. It's a quick and painless test that uses X-ray technology to produce detailed images of your brain. You will be asked to lie flat on a narrow table that slides into the CORT machine. During the scan, it's important to stay very still, as movement can blur the images. The scan usually takes only a few minutes, making it ideal for emergency situations. Sometimes, a contrast dye may be injected into your vein through an Raman-Pha line. This dye helps highlight blood vessels and can make abnormalities easier to see. Before the injection, you will be asked about allergies, especially to iodine or shellfish, because these can cause allergic reactions in some people. If you are allergic, your healthcare team will take extra precautions or choose a different imaging method. The CORT scan is especially good at detecting bleeding in the brain, which is vital because treatment for bleeding strokes differs from strokes caused by blood clots. However, in the first few hours after symptoms start, a CORT scan might not show a blood clot clearly. If more detailed images are needed, or if the initial scan does not provide enough information, an MRI scan might be ordered. MRI uses magnetic fields and radio waves to create sharper images and can detect ischemic strokes earlier than CORT. For an MRI, you will need to remove any metal objects like jewelry, hairpins, or hearing aids. The MRI scan takes longer than a CORT, often around 30 minutes or more, and some people may feel claustrophobic inside the machine. It's important to tell the staff if you have any metal implants or devices, as some may not be compatible with MRI. Throughout the process, the medical team will keep you informed, answer your questions, and ensure your comfort and safety. Their goal is to get clear, accurate images quickly so they can determine the type, location, and extent of your stroke. This information is essential for deciding the best treatment plan and improving your chances of recovery. In summary, before a brain scan for stroke diagnosis, you can expect a quick clinical review, instructions to lie still during the scan, possible use of contrast dye after allergy checks, a fast and painless CORT scan as the first step, and potentially a follow-up MRI for more detailed imaging if needed. You will be asked to remove any metal objects for the MRI, and the staff will guide you through each step. This preparation helps ensure the most accurate diagnosis and supports timely treatment, which can make a big difference in stroke outcomes. Always remember to discuss any concerns with your healthcare team and follow their advice for the best results.